it's transposed now from a hierarchical sort of master-apprentice model to a highly collaborative model in the context of evaluation and power differential. What do I mean by that? I mean that instead of a supervisor simply telling you, do that, do that, do that, for the most part, except in urgent situations like life-threatening or reporting kinds of responsibility issues, the supervisor has transformed to one in which your input and your development is really an important part of the process. Supervisors are learning that they learn significantly from their supervisees, and that supervisees bring much strength in terms of competence to the equation of supervision. What do I mean by competence? In this framework, competence means knowledge, skills, and values. Do you know which one has been really highlighted most in training? If you think back on your own training, the one that really gets the most attention is knowledge, and that's followed by skills. But values is really quite neglected, and we'll spend a few minutes thinking about that because values are really important in our clinical work and in our clinical supervision. Okay, everyone who writes a book has their own definition, and we are no different. We have a pretty long definition. And our definition is of clinical supervision, that is distinct professional activity. Why is that so important? Well, across professions, many professions have come late to the idea that supervision really is a distinct professional activity that requires specific training, that it is not simply a process that's acquired through osmosis. In other words, just simply having been supervised does not provide you with the platform or the skills or the knowledge or the values to be a supervisor. So it is truly a distinct professional activity in which education and training aimed at developing science-informed practice are facilitated. Now what does that mean? Well, that means not that you all have to go back to school to get a physics degree, but in fact that we all are becoming increasingly thoughtful and focused on the impact of clinical supervision and how in fact science-informed practice relates to outcomes, and it also relates to our underlying thinking, our hypothesis testing, and our ideas about clinical practice. This is facilitated through a collaborative interpersonal process. Now this is kind of a newer idea, and that is that supervision truly is collaborative, that everyone comes in with their own strengths, and those strengths are developed interpersonally through the process of supervision. And that you are a major contributor. It's not just you sitting there listening to your supervisor, that you are bringing significant knowledge, skills, and values to the process. It involves observation, evaluation, feedback, facilitation of supervisee self-assessment. Now let's stop for a second and look at each of those for a second. Observation means, ideally, your supervisor will have a chance to observe you. Now this could be through co-therapy, this could be through audio or videotaping. This is an incredible strength because of, and we'll get to metacompetence in a few minutes, but because of metacompetence, without observation, it's very difficult to grow. You only know what you know. You do not know what you do not know. None of us know what we do not know. Therefore, it's a true limitation if supervision is only based on what is reported by the supervisee. Not that supervisees do not have the absolute best intention. It's simply that we only know what we know. Second of all, the evaluation piece. And this is where in your system it really is important to think because you've got the administrative piece superimposed over on the clinical supervision piece. And the evaluation could be in both segments. So evaluation is ongoing, and we have various kinds of evaluation. One is called formative evaluation, and that's ongoing evaluation. That should occur very frequently so that there are no surprises. That's one in which you are given feedback, hopefully based on your own competencies document, like your own core clinical competencies. So you are given feedback and you are self-assessing your own performance. and talking to your supervisor about what areas you feel you are really making progress in and which ones you'd like to target for future development. In this way, your own self-assessment and development are facilitated through the process of supervision. Now, just to take a side note here for a minute, you may wonder if it's safe to self-assess and really identify areas you'd like to learn more in. In this framework, it is valued more that you in fact disclose things that you do not know or are not sure about or want to develop than for you to come in and say, I'm absolutely perfect on everything. That is not valued so much because none of us are perfect. We're all in a learning curve, all learning and developing. Okay, moving right along, this involves acquisition of knowledge and skills by instruction, modeling, and mutual problem solving. Your supervisor should be in a position to instruct you, to demonstrate for you certain skills and certain techniques, and to mutually problem solve with you, to come up with intervention strategies and ideas. Now you may say we're in too big of a hurry, we have too many cases, but in fact if you can slow down for a while and target maybe even one case during each supervision session, you'll find that there's tremendous progress that can be made. Okay, we're still in the definition. Building on the recognition of the strengths and talents of the supervisee, supervision encourages self-efficacy. What this means is everything that you bring to supervision, things, all the skills and all the talents that you've had, some of which you may have even put sort of on the back burner, thinking this isn't relevant to your work. These are all important parts of supervision. And through supervision, you will develop increased self-efficacy, which means when given a particular task or client, you will feel effective in that particular situation. And self-efficacy is targeted to one particular small task at a time. Supervision ensures it's conducted in a competent manner in which ethical standards, legal prescriptions, and professional practices are used to promote and protect the welfare of the client, the profession, and society at large. So this places it in the context of all the ethical and legal standards of the provincial government, of your professional association, of your particular setting, all of these to, in fact, keep our focus on the welfare of the client, because our highest duty is protection of the client. Sometimes it's confusing because the supervisor may, in fact, be focusing so much on the client over you. That is correct, because their highest duty of the supervisor, and of course of you, the clinician, is to protect the welfare.
Can you clarify what you meant by feedback in the context of the collaborative interpersonal process?
Okay, what is feedback in the context of the interpersonal collaborative process? Well, as we've discussed a little bit, this feedback is kind of a core concept because it is, in fact, the ability for an individual to target particular behaviors or competencies, knowledge, skills, or values in the context of everyday life, so that as your supervisor is observing you, giving input, your supervisor may be giving you feedback, which would be like, as you're presenting that case, I notice that you have much less affect than you usually have. You seem sort of blunted. I wonder what that's about. That would be an example of online kind of feedback. Now, what if the supervisee didn't feel that was the case? The supervisee could say, you know, it's so odd you're saying that. I don't know that that's, I certainly haven't perceived that. Let me think about it for a minute and reflect on it. But anyway, the feedback could be two-way. The supervisee could say, you know, I don't think it's related to that, unfortunately. I didn't get much sleep last night, so I think it's not about this client. You're right, though. I'm kind of feeling a little depleted today. But that would be so important for the process so that the supervisor doesn't jump to conclusions that are incorrect about the process. So feedback needs to occur, specific and linked, and it is an important part of collaboration. And sometimes supervisees, clinicians, can begin the feedback.